Hello, my name is Evan Huggins, and I'm a fourth year medical student from the Ohio University campus in Dublin. And today I'm presenting to you a demanding differential in a probable case of sporadic Creutzfeldt-Jakob disease. Starting off with the case, a 68-year-old male with a pertinent past medical history of type 2 diabetes and cervical myelopathy presented to the ED for worsening confusion and difficulty ambulating and recent slurring of his words. According to his spouse, they were traveling across the United States by car and they consumed spoiled seafood in South Carolina in September of 21 and claims no other risk factors. On initial physical exam and labs, the patient was oriented times one, could state his date of birth, and was only able to follow simple commands. This inhibited our ability to perform a neurological exam because of patient participation. He had a leukocytosis with a white blood cell count greater than 15, and his ammonia, CT, head, chest, abdomen, and pelvis, and UA were all within normal limits. Additional diagnostic testing consisted of an MRI, which showed bilateral symmetric signal alteration of basal ganglia and thalami without associated mass effect. Considerations at this time were due to toxin exposure, metabolic disorders, viral infections, or prion disease. Testing for these additional causes and other acute processes were all negative. And then finally, continuous EEG revealed seizure-like activity with triphasic morphology complexes. Magnetic resonance imaging was also acquired at the Circle of Willis and brain, which showed restricted diffusion in bilateral basal ganglia and caudate nuclei in the medial aspects of the frontal lobes, suspicious for prion disease. And then finally, cerebrospinal fluid was collected, and an RT-QUIC was sent to the National Prion Disease Pathology Surveillance Center in Cleveland, which were positive for the 1433 and tau proteins, indicating Creutzfeldt-Jakob disease. While all these testing and imaging processes are all non-diagnostic as a biopsy is required, they all are highly indicative of active prion disease occurring in this patient. Just a little bit of background, Creutzfeldt-Jakob disease, or CJD, is a fatal prion-induced spongiform encephalopathy due to the misfolding of the PRP protein to PRPSC in central nervous tissue. Per the CDC, spontaneous CJD occurs roughly 1 to 2 cases per 1 million. From symptom onset, life expectancy is within 1 year. And currently, there's no known forms of treatment to halt progression or cure the disease. From this image I acquired from the CDC, over the course of the past 40 years, there's been an increasing number of deaths of individuals due to CJD, with around 200 succumbing to the disease per year, all the way up to the mid 500s as of recent in 2020. Regarding this patient's clinical course and outcomes, his slurring of his words increased to a point where his speech became incomprehensible. He displayed a decorticate posturing as well as the startle myoclonus that can be seen in CJD. He developed pronounced Babinski reflexes. He developed cortical blindness, which was confirmed by ophthalmology. The patient was started on Keppra during the hospital course, which was continued after discharge. He was discharged to a skilled nursing facility with neurology following, and unfortunately, the patient deceased approximately 1 month later. Overall, the significance of this case, number one, shows the emphasis for a thorough neurological exam. Again, this patient was unable to participate, but the other findings that we were able to acquire from his neurological exam allowed us to point to more uncommon forms of pathology. Number two, starting with a broad differential, using your clinical, laboratory, imaging, additional study, and exploration of the literature also allowed us to rule out common causes of encephalopathy and allowed us to point to more uncommon causes like prion disease. Thirdly, reassessing for and testing for rare pathologies. And if initial study testing remains unremarkable, is essential. Asking yourself those questions: what more could we be doing to help diagnose the patient? And then finally, additional studies could also be generated around this case. Going back to the image I just showed a few slides ago, since the cases have been increasing over the course of the past 40 years, could be a great additional area of study to help try to figure out why these spontaneous forms are happening. These are my references. Thank you very much for listening and have a great day.